4 webinars on uterine fibroids and adenomyosis. We already completed 3 webinars, and today is the last of the webinars. I have all in all 20 experts and 1 mystery guest, and the mystery guest will be with us today. So somebody has to remind the mystery guest. My co-chairperson all the way from Surabaya is Dr. Relly, Yanuari, and he works in Department of OBGYN of Dr. Sutomo General Hospital and also at the Medical School of Airlangga University, Surabaya, Indonesia. He is a professional member of Indonesian Gynaecology Endoscopy Society, ISGE. He's also a member of the Asian Pacific Association of Gynae Endoscopy, APAGE, and he's also a member of on uterine fibroids and adenomyosis. We already completed 3 webinars, and today is the last of the webinars. I have all in all 20 experts and 1 mystery guest, and the mystery guest will be with us today. So somebody has to remind the mystery guest. My co-chairperson all the way from Surabaya is Dr. Relly, Yanuari, and he works in Department of OBGYN of Dr. Sutomo General Hospital and also at the Medical School of Airlangga University, Surabaya, Indonesia. He is a professional member of Indonesian Gynaecology Endoscopy Society, ISGE. He's also a member of the Asian Pacific Association of Gynae Endoscopy. I really don't know what happened. Looks like somebody has recorded my introduction and playback at the same time. So, okay, let me explain. All of you are all over the world. I'm in Singapore as the chairperson, but the control center is in Chongqing. So can we have some understanding that sometimes errors like this can crop up, technical issues like this can crop. Let me finish. Relly is the chairman of Fertility Endocrinology Reproduction Division of the Department of OBGYN of Dr. Sutomo General Hospital, Medical School of Airlangga University, Surabaya, Indonesia. He's also the chairman of Indonesian Permanent Contraception Organization, and he's also the endoscopy task force of Indonesian ONG Association, and very proud, he's the chairman of the 19th APAGE Congress at Surabaya. I'm very happy to show you my next slide. Okay, this is one slide I cherish a lot because it shows here Relly is the organizing chairperson with all my friends with a picture taken in front of the stage at the 19th Asia Pacific Association of Gynaecology Endoscopy. I'm also happy to say this was the first official scientific program where HIFU is introduced. So this is the first time officially APAGE heard about HIFU. And thanks to Professor Lee Chilong for accepting the scientific program of HIFU. Okay, my good friend here, Professor Hugo Verhoeven. He's the Medical Director of Private Center for Endocrinology, Reproductive and Preventive Medicine, Düsseldorf, Germany. He's the chairman of ESGE Working Group on Non-Surgical Ablative Therapy of Benign Uterine Disease. So it's a very important person, and we have him to thank for becoming a liaison of Asia and Europe again. Why do I say that? Because Germany is famous for beer and all the beautiful ladies, and that's we met up again in this picture after many years. He has disappeared from the scene, and then we met up in China, and we had a very nice discussion with the group of friends from Taipei, Professor Lee Chilong, and also Wang Zipiao, Rosie, and Ping in an informal setting. And this one. Well, you know, when you talk to Hugo about anything, he's an expert on it. And even at dinner at the dinner in the seafood restaurant, he would talk to me about how to do a laparoscopy on a crab. So that's Hugo for you people. And I'm glad I met Professor Friedrich Gill, and you would notice there's this Mr. in front, and I guess Professor Gill probably has a surgical or general surgical degree as well. He's a medical director of Medical Center Margareten, Vienna, Austria, and head of IVF Clinic Baden, Austria. He's a member of the working group on non-surgical ablative therapy of benign uterine disease. So he works very well with Professor Hugo. And I know he has successfully finished the first laparoscopic hysterectomy in Austria and the second in Europe back in the year 1993. Now, when I got off the plane and stepped onto the ground of Austria, and you know, Austria is really the sound of music, and the culture is all very musical, and people are very pleasant. And that is Professor Friedrich Gill. Now, today, I've introduced my co-chairperson, my panelists, and very important, the speakers. All the way from Bangkok is Dr. Olarik, and all the way from Shanghai is is Professor Aixingzi Aili, very elegant lady. So I would like to say this whole series is organized to introduce HIFU, and I believe this procedure will change the practice of gynecology and adds a new dimension to the treatment of uterine fibroids and adenomyosis. This is a virtual knife, and this is where the invisible knife comes up from the bow below. Okay, I've noticed a special guest is in the audience now. I would like to tell a little story and introduce someone special. You know, long ago, physicians likes to listen to the heart sounds and the chest sounds with the ear to the body. And obstetricians, gynecologists will examine the pelvis of a lady in the Victorian era in such a manner. Dr. Lynette was the first physician to use a tube to listen to chest sounds. From what looks like a tube to what looks like the stethoscope we have, which you use nowadays, it took 132 years. And in 1988, Professor Wang sets up the research team on HIFU applications in Chongqing. And in year 2000, HIFU was approved by Chinese authority for the treatment of tumors, both benign and both cancerous. This is a picture of Professor Wang Zibiao. And notice he took just from 1988 to year 2000, just 12 years to transform what I call a heavenly knife to something that mankind can use for the benefit of our patients. And I think you have seen this picture many times. Do you notice that there's always a very quiet person, gentleman sitting in one corner? Well, he's one person who doesn't like the limelight. He's always in the laboratory and always working. And that is Professor Wang Zibiao. He's actually the founder and the inventor of the present-day HIFU knife, but he's a very humble person. We are fortunate today we managed to encourage him and say a few words. Professor Wang Zibiao, who is the inventor of ultrasound HIFU of Chongqing. So maybe Chongqing, over to you. Can you get Professor Wang Zibiao online to meet us?
Hello. So Professor Wang will talk in Chinese and I will interpret it into English. Thanks a lot, Professor Lee, and hello, Hugo. You can hear us?
Yes.
Okay.
Yes, very good. Thank you.
Thank you. 今天很高兴啊，参加我们亚太这个腔镜协会里面专门就是对腺肌症的微复创、腺肌症的聚焦超声治疗的这个专题会议。
Today I'm very happy to join this webinar, a webinar about adenomyosis, which is co-organized by APAGE and ISMIVS. It will focus on the minimally invasive treatment and the HIFU treatment of adenomyosis.
这个经过了这个疫情呢，今天看到李教授，看到霍格教授，很高兴。这个会议我也相信，在这个疫情期里面，还没有完全解决这个世界的疫情期里面办这个会，我相信也是 从另一个更阳光的角度，这个更健康的角度来面对这个今天这个世界。
Okay, so it's very happy to meet friends like Dr. Lee, Hugo in such condition, the COVID-19 situation. And we think that we organize this webinar in such condition is like we bring some light into the doom sky to make it brighter.
我这儿要跟大家汇报2个消息。第一个消息就是上个月，中国正好这个就子宫腺肌病呢、腺肌症，专门这个在腺肌症的专家共识里面，已经把聚焦超声写进了这个共识里面。这是第一个消息。
I have 2 news to share with you today. So first one is last month in June. The HIFU treatment of adenomyosis was included in the Chinese experts' consensus.
而且正式4月7号发表在中华医学杂志上，这是中国的医学的最顶级杂志。
And it will be published in the Chinese Medical Doctor Journal soon. 10月份是吧？
不，
in June. In June, it has already been published in the journal.
Yeah.
It is one of the top journal in China.
而且4月份，李建威教授也参加的，包括这个范长达院士也参加的，这个中国医师协会也在这妇产科的刚刚是最顶级，也在中国那个中华医学杂志上发表了整个聚焦超声的共识。
Okay.
就是共识。
In this year in April, we also have published the guidelines about the HIFU treatment of uterine fibroids in China.
其他肿瘤、恶性肿瘤也同时发布技术规范。
Also included other malignant tumors.
是的。第2个消息就是在预行期3月份，这个中国政府批准了一个国家重点实验室。这个国家重点实验室的名称叫超声医学工程国家重点实验室。那么这个批给了我们重庆。
And another news is about the state key lab of national state key lab of medical engineering ultrasound medicine, which was approved by the Chinese government. This lab was belongs to Chongqing Medical University.
那么这在中国也是唯一的一个这个领域唯一的一个。
This is the only one in this field.
所以我在此时此刻是感谢大家，由于我们李教授，整个亚太这些教授们的工作，那么让我们拿到国家的重点实验室，也感谢 Hugo 我们欧洲的这些团队的工作，所以这是一个整体的这个荣誉属于大家。
I would like to take this opportunity to extend my gratitude to all the experts who have contributed to this, such as Dr. Lee and Hugo. I think this honor belongs to everyone, not just only us.
当然，我更希望今后在这个国中建设里面有各位教授的智慧和辛勤的劳动。
And I hope in the future you will help us also devoted into the construction of this lab to make it better.
好的，我今天主要也跟大家打打招呼。好，希望大家这次会议预祝今天的这个线上会议成功。谢谢大家。
This is what I want to see, and I hope this webinar will be successful. And thanks a lot.
Thank you.
Thank you. 谢谢，谢谢，
谢
谢王教授，谢谢。
好。
Okay, thank you very much. And we move on because Professor Wang has another meeting to attend. Again, this is brought to you by the 2 organizing societies, APAGE and ISMIVS. Again, APAGE stands for Asia Pacific Association of Gynaecology and Endoscopy, founded in 2003. Let's take a walk down memory lane. A picture which I've shown before, the founding members are in this picture, and you have Professor Li Qilong and President-elect Prashant and Harry Rich. And what I want to show is the picture taken in 2003, and you can look at how different this man, his name is called Hugo Verhoeven, how different he is from today. This is...
Whoa,
President of ISMIVS, Professor David Cranston, Oxford University. We have him to thank because his group actually helped us to introduce HIFU into the curriculum of NICE guidelines. This is the board. Right now, ISMIVS is the old name. It is called ISMIVS. And whenever ISMIVS has a meeting, it's always thousands and thousands of people. These are pictures of all the audience. And I noticed friends from Somchai, Vira, Felix Wong, and of course, Antonia is behind from Spain. And this is perhaps the most important picture I want to show, where the two organizations signed MOU to cover HIFU training and education, research, and very important certification, because HIFU is not as simple as seems to be, like pressing a few buttons. It is really a whole package of engineering, discipline, management, and preceptorship. So that's why certification is important to protect the patient and also to protect the organization that is moving into HIFU practice. There are two different versions of therapeutic HIFU. One is the MRI guided thermal HIFU, and the other one, which is we are talking about for the past 2 months, is ultrasound guided HIFU, which gives you the ablative power, the ablative capacity. Until December 2018, ultrasound guided HIFU has been used for more than 26 countries and regions. And then 120 cases has been done compared to just 4,000 cases in MRI guided HIFU. And I just had a quick calculations, which means there will probably be about 6,000 cases of ultrasound guided HIFU done every year compared to 200 cases of MRI guided HIFU done annually. So that's the difference. Okay, the main difference, since this is the last episode, I will dwell on it a little more. Of course, anatomical resolution is superior in MRI-guided HIFU compared to ultrasound. In MRI-guided HIFU, they use monitoring as the deciding factor of how much sonication to be delivered, whereas in ultrasound-guided HIFU, it's really live, real time. The transducer movement of the MRI-guided HIFU is limited because it's in the MRI machine. As all of you can imagine, once you're in the chamber, in a tunnel, there's not much movement you can do. Patient positioning, again, because it's in a tunnel, you cannot move the patient much. In fact, you have to tell the patient to keep still. Because of that, treatment time in MRI-guided HIFU takes longer compared to ultrasound-guided HIFU. Treatment efficiency, now MPV stands for how much treatment efficiency you can deliver. It's usually about 20 to 50%, but if you want to have good treatment results, you need to have an MPV of over 70%. So ultrasound-guided HIFU gives you an MPV of 80 to 90%. Also, in MRI-guided HIFU, we have to trouble our radiologists because they are the one actually operating the machine, and MRI machines are very expensive. A lot of people are waiting to use it. Whereas in ultrasound-guided HIFU, we just need the MRI-guided image to be mounted in the machine, and any gynecologist or trained doctor can operate the machine. So just to recap, MRI-guided HIFU is not real-time. It takes 12 to 30 seconds of sonication. In other words, when you press the button, it's 12 to 30 seconds of energy delivered to the patient continuously. And you know how long is 12 to 30 seconds? If you sing happy birthday, it's like singing the happy birthday clause twice. And then you have to have 90 seconds of cooling, and you hope, keeping your fingers crossed, that the bowel does not move into the line of fire to the uterine fibroid. So whereas in ultrasound-guided HIFU, it is ablative in nature, the procedure can be done by gynecologist, surgeon, or radiologist, or any trained doctor. The duration of ultrasound-guided HIFU procedure is independent of the MRI machine. So the MRI machine can be put to better use for the other colleagues in the same hospital or in the same setting. Now, I will invite my co-chairperson, Dr. Relly, to introduce Dr. Olarik, and then we have Dr. Olarik to give the lecture. So over to you, Dr. Relly.
Yeah, thank you. Just a moment. Thank you, Dr. Kim, for your very, very nice introduction for us, and we're very glad we can join again with our webinar. So I want to introduce this first speaker. Is Dr. Olarik, is our friends from Thailand. He is Dr. Olarik is work in the Taipei Behu Hospital. Sorry, my pronunciation is not so good for Thailand spelling. His area of interest is reproductive medicine, gynecology endoscopy, clinical research epidemiology, and health technology startup. And since 2016 until now, he was his social media team of American Society of Gynecology Laparoscopy. And 2018 until now, he's assistant director for lecturer and research affair of Medical Education Center. And 2019 until now, he's a chairman of Subcommittee Continuing Professional Development, the Royal Thai College of Obstetricians and Gynaecolgiests. And 2019 until now, also, he's a Subcommittee of Reproductive Medicine and Subcommittee Gynaecology, the Royal Thai College of Obstetricians and Gynaecologists. So it's time to you, Dr. Olarik, for your presentation, please.
Thank you, Chairman and Co-Chairman. Thank you for having me here. Good evening in Thailand time, and maybe good afternoon in Europe, right? Good afternoon in Nigeria. We have our friend from Nigeria and South Africa. Okay, I would like to share my slide. Let me check. Okay, can you see my slide?
Yes.
Yeah.
Okay. Okay. So today I will talk about the adenomyosis, tip of the iceberg in infertility. Okay, and this is my hospital. Can you see my hospital?
Ooh, looks like a palace.
Yes. It's like it's an old palace. It's 110 years old already. Professor Hugo already visit our hospital. Okay. Okay, so and please feel free to contact me via the WeChat, because I know today we have a lot of the audience from China. You can save my presentation also. Okay, and for the disclaimer, I don't have anything to disclaim. Okay, the outline today is I will talk only two topics. Okay, evidence base of adenomyosis and infertility. And the second one is experience base of adenomyosis and infertility, because Professor Lee, he's talked to me that we want to like a panel discussion. We want to know about the experience, not only the lecture. Okay. So what about the evidence base of adenomyosis and infertility? I think all of us know the type of the endometriosis. Now we have 4 types of the endometriosis. The first one is a peritoneal endometriosis, that the lesion is on the peritoneal cavity. The second one is endometrioma. It means the endometriosis at the ovary. Even one side or both sides is endometrioma. The third one, and I think this is very difficult for the surgeon, I mean for the gynecologic laparoscopy to do, is deep endometriosis. The definition is not really clear, but some literature said deep endometriosis is endometriosis lesion is deeper than 5 millimeters And the fourth one is this. Is this a nightmare of the infertility treatment? It is the adenomyosis. Okay, so how it happened? This is the good picture for the theory of the endometriosis. The first one is very famous. It is Samson theory. It is a retrograde reflux of an implantation of the endometriosis tissue. Okay. The second one is early embryonic development of the lesion. And the third one is in situ metaplasia development. Why we have three theory? Because now we know that only one theory cannot explain how the endometriosis is occur. And this is the endometriosis. I will show the theory of the adenomyosis. Because now we know that maybe adenomyosis have the different pathophysiology of the endometriosis. This is the literature from my good friend Sylvia. He published about 2 years ago. It is about the theory of the pathophysiology of adenomyosis. Is it the invasion of the endometrium to the myometrium tissue? And there is a tissue injury and repair. Repeat and repeat and repeat. Okay. After that, there is some proliferation and fibrosis. And also there is abnormal sexual receptor. We know that in endometriosis, there is increase of estrogen receptor, and there is a downregulate of progesterone receptor. And there is also the inflammation of the tissue, and there is a new neuroangiogenesis. That's why the lesion can grow by itself. And this is the another good theory. Now we have a theory about the adenomyosis. The first one is invagination from the endometrium to myometrium. This is the first one. The second one is that there is a stem cell in myometrium, and there is a new growth, or we call the de novo, in myometrium tissue. And the third one is invagination from the outside. Professor Chapon showed the data that there is a correlation between DIE and endometrial and adenomyosis, because the DIE will infiltrate from the outside to the posterior wall of the myometrium or the uterus. And he showed the data that show there is invagination from the bladder endometriosis to the anterior wall of the uterus. By the way, we know that only one theory that cannot explain. So why we have the three theory? Okay, and how we diagnose the adenomyosis. And now we don't have the clear statement how to diagnose the adenomyosis, only a histology after we do the hysterectomy. But how about the imaging? There are a lot of the school want to describe how to diagnose the adenomyosis. But I think this is very good one and very easy to understand. We call that this is MUSA, morphological uterus sonographic assessment. We have a variety type that we can looking by the ultrasound. The first one is line and birth. The second one is echogenic Iceland. The third one is the cyst. And after that, if the disease is progressed, we can see the irregular of the junctional zone. We can find the five shape of shadowing. Someone said it's like a moose head, something like that. And the indirect side is a globular shape of the uterus and asymmetrical thickness of the uterine wall. Okay, and this is, I think, is very, very important that we need to know and we need to do. It is about how we describe the adenomyosis or how to report the adenomyosis, because the location of the adenomyosis the size of the adenomyosis is affect to the infertility treatment. I think it's same as the myoma. Now we have the physical classification of the myomas 8 type. We have to describe type 1, type 0, type 2, because the location, the size is affect on infertility. And now this I show you this type of the adenomyosis. The location, focal or deep field, is it a cystic or is a layer extend the size? This is very important. Okay, so we know that adenomyosis and endometriosis associated pain. The woman will have the dysmenorrhea, dyschezia, and also dyspareunia. Dyspareunia is very, very important, but because if the woman have the dyspareunia, she can not have sex. So if she don't have sex, how to have the baby? Okay, so this is very, very important. And how the endometriosis and adenomyosis affect the infertility. There is some data. Let's talk about the sex and endometriosis. There's the data nearly 50% suffer from painful sex if they have the endometriosis. Okay, and this is the pathophysiology and of the endometriosis. It's effect of the uterus. It's affect uterus. It affect peritoneum cavity and also the ovary. I don't have time to tell you the detail how it affect the infertility, but I think you can discuss after this. Okay, this is why endometrioma affect the infertility. There is a very, very special molecule study how it affect. Okay, it's not only about the infertility, but its effect on the reproductive outcome. There's the data show the increased rate of spontaneous miscarriage in endometriosis, and also have the adverse effect on the preeclampsia, on the placenta malposition. You can see most of the outcome is statistically significant. Spontaneous abortion, PIS, I mean the preeclampsia, gestational hypertension, chronic hypertension, GDM, fetal malpresentation, and also the preterm delivery. And some studies say that there is an effect on the ESGE, small for gestational age. And how we manage the adenomyosis. This is the basic treatment. The first one is expectant. The second one is medical treatment. I mean, we can use the GnRH agonist, we can use the progestin, we can use the aromatase inhibitor. I will tell you after this. We have the surgery, radical surgery, conservative surgery. That's sure for, in our field, for the infertility treatment, we cannot do the radical surgery, except the lesion or the disease is very severe. We have to radical surgery and then go to use the surrogacy. And another treatment is uterine embolization. And I think Professor Aili, she will talk about the HIFU. Okay. What is the role of the medical treatment in management of adenomyosis? We have a lot of the data that the medication is very, very effective treatment for the adenomyosis, for pain, for abnormal uterine bleeding, but not for infertility treatment. Okay, this table is very clear to show that the mechanism of the action of the GnRH agonist, when you inject to the patient, she will go to the hypoestrogenic state. So that's why the disease is improved. The progestin, we have a lot of type. The progestin, we can use the MPA, we can use the dianogest that can treat pain. Abnormal uterine bleeding is very good, but not for infertility treatment. LNGIUS, we use the levonorgestrel IUD put inside the uterus. And after that, there is no bleeding or the bleeding is decreased. But we know that it is a contraception, right? And COC, the mechanism is a decidualized and a subsequent atrophy of the endometrium. And we know that it's a contraception pill. Okay, the NSAID is very good for the pain, but there's some data that the NSAID, when you give to the patient, there is no ovulation, there's no rupture of the oocyte. So most of the medical treatment that not give the benefit for the infertility treatment. Except the GNIS agonist, we have a lot of the data that for the long protocol, we give GNIS agonist before the treatment of the IVF. Okay, sometimes there's a pregnancy rate is increased, but we need more data. Okay, so how about my experience based on the adenomyosis and infertility? And for this year, I am the chairman of the ASIM SIMSIC. What is the SIMSIC? SIMSIC is a complementary and integrative medicine special interest group. That means I use everything for my patient to get pregnant. This is the definition from the USA about integrative health. What is the integrative health? It's a conventional plus complementary approach to make the patient better. Holistic approach, patient focus, wellness, mental, emotional, functional, spiritual, social, and community aspect. We look for the whole person. Because of infertility, we treat the patient. We not treat only the disease. Most of the infertile couple, they have a psychological problem. They suffer that they cannot have the baby. And now they suffer, they have the disease like adenomyosis, endometriosis. The women have a pain, have a dyspareunia. So we have to look for the whole person, not only the adenomyosis. This is my experience. Even the patient cannot peg by herself. They can use the surrogacy. We not treat the adenomyosis, but we treat the infertility for them. Okay, this is the option. So the most important thing I think is infertility treatment care plan. This is my picture during the COVID-19. Now in Thailand, we don't have a new case for almost 2 years. Most of the new case, they're from abroad and stay in the state quarantine. This is a new normal. I have to wear the eyeglass. I have to wear the mask all the time. I have to use the telemedicine to talk to the patient. Okay, and sometimes I use the PPE to do the operation. Okay, in my experience, when I treat the adenomyosis and infertility, most of my patients, they have combined. It's not solely adenomyosis, but mostly combined with endometriosis and pelvic adhesion. So I do a lot of the laparoscope. And this is the robotic acid machine in my hospital. So I'm a solo surgeon. My nurse, she can sit outside the operation room to wait for my operation. You can see this is a voice control. It's very good, and my nurse loves it. Okay, and this is okay. This is my diagram when I see the patient who have the adenomyosis and endometrioma. Mostly, I do the operation because my patient have a pain, my patient have a dyschezia, so I do the operation. After that, I will allow them to natural pregnancy or do the IUI. But after our plan, if not success by the natural or the IUI, I will send the patient to do the IVF. Okay, this is my diagram. And thank you. So we have more time to discuss, and please feel free to contact me personally, you can save my WeChat. Okay, thank you.
Okay, thank you. Thank you, Olarik.
Thank you, Dr. Olarik.
Thank you. We'll leave the question and answers to the end. Okay, next. Let me share my slides. Okay. Next, we have the very elegant Professor Aixingzi Aili, all the way from Shanghai. She's the head of HIFU unit, the first affiliated maternity and infant hospital of Tongji University. She's the deputy director of the endometriosis group under the Shanghai Medical Association of Obstetrics and Gynaecology. She's a member of the minimally invasive and non-invasive medicine committee under Chinese Medical Doctor Association. She's honored as the Woman Pace Setter of Pudong District in the year 2013 and 2014. Also acknowledged as one of the top 10 angels of maternity and infant care in the year 2016 and 2017. Now, as far as I know, HIFU is the spring of the sufferers of adenomyosis, and in Mandarin, 海服是妇女的春天，但是我觉得海服
是腺肌病的春天。
腺肌病的春天 ，OK， 对不起啊，但是我觉得你是你的医院的春天，因为为什么你把那个海服刀已经推广的很多妇女都接受，所以很多妇女就排着队所以来看你，更谢谢你。
Yeah, it's true.
Okay. Well, this is a picture taken when I first met her in China, and her topic today is on HIFU experience in Shanghai First Maternity and Infant Hospital. So let's have Professor Aixingzi Aili to share her slide. Aixingzi, please, over to you.
Okay. Good evening, all my friends from all over the world. On this special circumstance of virus time, life is not easy for all of us, especially for all people who work in the front line. No matter what is happening, we as doctors should never stop sacrificing ourselves. Like today, we are still learning something. It's my great honor to be here to share some experience about HIFU treatment. This is the place I am staying now. I'm from Shanghai, the first maternity hospital. This is the beautiful Shanghai. And I hope in the future sometime you can come to visit us. Our hospital was built in 1947. It's really a very old hospital compared to some new hospital. At the front, this building I'm sitting on at the moment. There are some official information about our hospital, like the history, and we have 2 campuses. I am in East Campus now. And we have 2 huge buildings and a huge area, and our hospital in many medicine scientists also located in a very high level in China, like National Nature Science Foundation of China. Recent several years, our hospital in the top 1. Our hospital is famous for obstetric mainly. Every year, annual delivery quantity nearly 30,000 cases. And this is the obstetric team. The head of obstetric, Professor Tony. I believe many of you can meet him before. And for gynecological team, the head is Professor Wan Xiaoping, who is full of ambition. He wants to create the top women's hospital in China. And the information show our HIFU cases ranked to #1 in Shanghai. But myself, I think there is no comparability because many hospitals still don't have HIFU equipment yet. We have many good teaching research and the clinical education also very well. And the HIFU system have been operating in 27 countries and region. Like this map, the right side for hold, we can see many countries already have HIFU and they are doing very well. Like Professor Li Jianwei, the APAGE, this conference sponsor. And the right side the map, we can see the whole China already in everywhere. It's just like blooming firework. This is a telemedicine big data center. When we do every cases, we will connect with them and keep every patient's very standard procedure and keep patients safe. This is the data from 2019. So from here, we can see our hospital in standard 3rd level. Every year, we finish the nearly 500 cases. Beyond 1,000 cases include the Swinning Center Hospital. Many friends already visit there and know the HIFU knowledge. The second hospital is 3rd Xiangya Hospital of Central South University, which is also very famous hospital in our area. Like Xiangya Hospital, the HIFU in charge by Professor Xue Ming, who is all around a very tough lady. Except HIFU, she is also on the top of robotic surgery. We are on the 3rd level now, but I hope we can come to the 1st level. I want to copy the message from Zhong Nanshan. Choosing HIFU may be an accident, but once we choose this and make the decision, we will treat the patients with lifetime loyalty and enthusiasm. Very important thing to keeping one new technique. The loyalty and enthusiasm both are very important. So we begin from 0. Now beyond 1,000 cases, we get a very long journey from 2050 up to now. The main cases we done include myoma and adenomyosis. Especially our research direction focus on endometriosis and adenomyosis. Like adenomyosis, the very important thing before doing HIFU, the types is very important. Up to now, many doctors like to use the types created by Japanese doctor. These 4 types include Type 1 is intrinsic, Type 2 extrinsic, external, and 3 intramural. Type 3 like teardrop deformation of the rectum. And another type staging system also accepted by many doctors include diffusion, endometriosis, focal adenomyosis, and the polypoid adenomyosis and other form. MRI classification recently can be used by some doctors. It includes internal adenomyosis, and external adenomyosis. Internal adenomyosis include A to D. A means focal or multifocal adenomyosis. B means superficial asymmetric. C means symmetric adenomyosis. D is diffusion asymptomatic. And E, symmetric adenomyosis. A little bit complicated. And the second types from F to I. solid, cystic, submucous, and subserous, little bit similar like myoma. External adenomyosis include posterior adenomyosis and K respectively with posterior and anterior deep adenomyosis. Recently, we put forward our research about the type classification. The first, we based on the traditional classification, focal and diffusion, and then divided into A, B, C. A means internal, B means external, C intramural, same as diffusion. Let's see the type 1, focal type, 1A. That means junctional zone boarding. There is normal muscular layer between junctional zone and the serous surface. Type 1B, there is normal tissue we can see between lesion and the junctional zone, and the lesion invade the uterine serous. Type C means there is boundary between intramural adenomyosis and the normal tissue. Diffusion type C, for A, lesion diffuse throughout the uterus and the junctional zone boarding, but there is normal muscular layer between junctional zone and the serosal surface. For B, lesion diffusion throughout the uterus and the invasive uterine serosa, but there is normal tissue between uterine cavity and junctional zone. This one maybe is good for pregnant again. Type 2C means lesion completely invade the junctional zone and the uterine serosa with diffusion throughout all the uterus. When we do the treatment, we divide it into 3 steps. First step is HIFU. Second step, like we already know, endometriosis and adenomyosis is uncurable disease. Also a chronic disease similar as like asthma and some chronic disease. So the second step, we usually use some different medicine. The very popular one is GnRHA, as all we know. We usually use GnRHA with remifemin. It's just keep the patient feel comfortable. The second very new medicine in China is Gynaecolgiests. The third one is a very old traditional medicine we call mifepristone. And the fourth one is gospel acetate. It's come from plants. Also the very good medicine to stop the menstruation. The third step is Marina. This is a paper we published last year about our treatment experience, combine the therapeutic effects of HIFU, GnRHA, and Marina for treatment of adenomyosis. So this is the best work of art. This is a very typical adenomyosis we will see. The first picture we can see the adenomyosis mainly occupy the posterior wall, the whole wall. And the second picture we will see one day after HIFU, mainly the lesion completely ablated by ultrasound. So I always call this our best work of art. The third picture we will see just after 80 days happened a very big change. The huge uterus has miraculously regained its beautiful form after non-invasive gentle ultrasound ablation. So this is the first step. I will show the small video here. So the patient lies down and we will let the nurse clean the abdomen. The first step. The second step, we will measure the size of the lesion and also measure the blood supplement. So combine the MRI and the ultrasound together. like GPS guiding when we driving. So the MRI also very important guide. And the third step, we will say through ultrasound, we will keep the patient in very good position. We will see the bladder. Bladder is a very important organ during the HIFU procedure. It can protect the bowel. We should squeeze the bowel out of the area, the zone. So we will see the ultrasound penetrate through bladder, focus on the lesion. We will find a safe and a sensitive area to begin. So usually the very important thing is the first step. So we will find a good, very important area or good area and put the ultrasound, the source inside of the lesion, and then we will get the good result. We will see the grayscale change inside of the lesion. So this is sometimes depending on, we should have very good head. So this is a case we done just recently. The first second, it's very useful happen. We can see the first second mass coming. Here is some data from our research. The first thing, the pain related with patients' quality of life. We will see the VAS and the VRS score compare before and after HIFU treatment dramatically reduce. After 3 months, 6 months, and 12 months, keep very stably. Same as localized adenomyosis and the diffusion ones. Here is the menstrual volume score compared before and after HIFU treatment. Also, we can see the same two types are the same. The second thing, except the pain for the patient worry about is heavy menstruation, hypomenorrhagia. So it's very good. After HIFU, the patients can have a very less menstruation or normal menstruation. The third change we can see here, hemoglobin also can change dramatically. This is a third problem except the pain and the heavy bleeding is the hemoglobin. So we will, some patients from rural village, the very severe situation come to our hospital. Sometimes it's very hard to treat. And the third thing is the uterine volume. The uterus can change dramatically. We already showed our best work of art. The uterus can change very well to normal. The 5 good thing is CE125. This is also up to now the very important tumor mark to evaluate the degree of adenomyosis or endometriosis. Also can rule out some malignant evidence. So here we can see after treatment, 3 months, 6 months, the 1 year, the CE125 can reduce gradually to the normal level. So we get the conclusion, the 3-step approach of HIFU, GnRHA, and the Marina is a very useful technique. It's a lower risk of hysterectomy. The second thing is also very safe, effective, and efficient. The third, it can improve the quality of life, especially for patients with localized adenomyosis. So I will show some the specific cases we done the last several years. The first one is very best one I already showed in our paper. So pre-HIFU, 1 day after HIFU, and 80 days after. So we will compare it, see, it's changed to normal. Is that like a magic? The second case is another huge uterus here, adenomyosis. 1 day after HIFU, we will see it's a heart shape uterus. And 3 months later, we will see the shape of the uterus coming. We will compare. So from here, this is a 3 months change, also very beautifully. So what we will do for the right side picture, we will see something still inside of the uterine cavity. So the step 3, we will do DNC, but we did not do directly. We will through hysteroscopy. Like diagnostic hysteroscopy, we will see inside of the degeneration tissue. The right side picture, we will see the very clean, beautiful uterine cavity. The tissue pathology result is high-grade degeneration. This is also the evidence to rule out the malignant disease. And recently, we also find a very good method to resection of endometrium. This video to show we do the resection for anterior endometrium. The second one is for posterior endometrium. So all we know, adenomyosis and adenomyosis, the main problem come from uterine cavity, the endometrium. So for those patients wouldn't like have baby again, no any desiration for pregnant after nearly 55 or even 40, we will do this procedure. Can destroy the old endometrium. We call it soft treatment. So no menstruation and no adenomyosis. Except the adenomyosis, the very useful treatment for HIFU is leiomyoma, diffusion uterine leiomyoma. All we know, diffusion uterine leiomyoma, DUL, is very difficult to treat. I met the patient, she already done 5 times operation, open laparotomy. So herself did not marry and her whole family nearly crazy for operation. So for DUL, the operation is not the best choice. And also the big problem for the patient wouldn't like to do hysteroscopy. From this picture, we will see the right side picture is before HIFU. After 4 months, we will see the uterus come to a little bit smaller. The fourth case is also the big adenomyosis. 1 day after HIFU, we also can see heart-shaped ablation area. 6 months later, smaller, and 16 months post change a little bit normal, but the lesion little bit coming again. The case 5, also the severe dysmenorrhea for 5 years, also adenomyosis. But after ablation, we will see mostly the lesion already ablated very well. The case 6 is also the diffusion DUL, diffusion uterine leiomyoma. This is a very young lady, only 29 years old. So 1 day after HIFU, we will see mostly all the myoma ablated. And 3 months later, we will see the uterus coming smaller, much smaller. The case 7, also myoma, 4 years of menorrhea. And we will see here the big myoma under the posterior wall. After 1 day, we will see the complete ablation. And 3 months, we will see the myoma already is very small. Nearly can neglect it. The case 9, also the best work of art, one of the myoma representative, the good effective treatment result for HIFU. This patient also had a menorrhea for 2 years. It's a myoma type 2, vaginal bleeding for 6 months. and we do the HIFU very beautifully. So we will see the result is very good. The myoma type 2 is also shrink very well. We will see in the right side picture, the myoma shrink to the nearly 1 centimeter. It's very easy to do the hysteroscopically move out. Case 10 is myoma type 3. So from here we will see after HIFU, 5 months later, the uterus coming normal. This is very good result because the myoma is screwed out itself, no need to do hysteroscopically. Case 10 is a myoma type 4, intramural myoma. So we will see after 1 day of HIFU, beautifully ablation. 8 months after, we will see smaller, much smaller. And the case 11 for multiple myoma. This kind of type may be very common in our clinic. So this is the big myoma here, anterior, posterior area, the myoma. So before HIFU, we will see the huge uterus, the fundus nearly to umbilicus level. 1 day after HIFU, and we will see 3 months later shrink to smaller, much smaller. So we will see lower than the umbilicus level here. So the patients nearly near to menopause, so not necessary to worry about the myoma now. Now the menorrhagia, so the menstruation is normal now. So case 12 is DOL again. So this is a very hardest one. After treatment, we will see the normal uterus coming here. So we will see the big uterus shrink, normal size of uterus. The third setting, I will share HIFU to treat C-section incision pregnancy. Also the very interesting cases. Here is a embryo position. Right side picture is MRI. So we will see after HIFU, the surrounded embryo already ablated very well. No any blood supplement. So after HIFU, 3 days or 2 days is okay. We will do hysteroscopy. We will see the embryo inside of the uterine, and we will do the suction, can pull all the tissue out. The 14th case, I will share placenta accreta. This is also the big problem in China because we have so many patients had a C-section before, and when they have a second child, it easily happen. So the first picture, we will see the placenta here. 1 day post HIFU, we will see mostly ablated. And 4 months later, we will see the normal, beautiful uterus coming again. So not necessary to the hysterectomy. Case 50, I want to share a field case. So it's not all myoma can be ablated by HIFU. This is the cases we done 2 years ago. So we will see here the very shining signal here. 1 day after HIFU, actually we will see it's not too bad. The result is still okay. The ablated area is enough for the myoma, but 23 months later, we will see it's come again. So we think for this type of myoma, it's not suitable to accept HIFU treatment. Last cases is really a happy ending. The first HIFU baby in our hospital. We will see from the right picture, there is a big myoma nearby the cervix. And this lady, when they pregnant, like nearly 30 she accepts the MRI examination for the baby. Then we focus on the myoma, it shrinks smaller. So that is very nice for the patients with myoma to pregnant. So myoma is not like as usual if the patient did not accept HIFU. So myoma can grow with the baby, but after HIFU, it can stop growing or even can shrink gradually. So this lady is our first baby. So we always holding the human first idea. We established the Caring Uterus Club. In Mandarin, we call 爱公俱乐部. We are holding the spirit of human first. We established the Caring Uterus Club to help those patients who really want to keep their sick uterus, especially multiple big uterus, very severe diffusion, adenomyosis. We have many ladies, they wouldn't like accept hysterectomy. They want to keep their uterus. So we established many WeChat group like caring patients. The step one is WeChat. Like in China, WeChat is very popular. The patient can give us any information when they happen. So we will give the reply anytime. So recently, one patient said they feel the harmony, the friendly relation between doctors and the patients. They feel so amazing. And she said, managing emotion well is a good medicine to overcome the disease. So very important thing to keep the patients in the very normal emotion. So this is our the 1000th HIFU baby. Also the very beautiful babies here. So the patient said in our clinic can cure the disease and cure the heart, and also can beauty conveys love, but I'm not sure it's right. And here she said the medical skill is exquisite and beautiful and harmony. So the patient gives us confidence to move on to do the more to improve our technique. So up to now we have many medical platform. We call multiple self-media platform to serve to help the patient. In China, very popular one is Good Doctors Online, 好大夫在线. We also create many specific special group to specifically to help the patient any question. So this is a cake, and also I have the patient. She made this PowerPoint, this slide. She said that the pain and the sick and calm and live, and she means the disease is very pain. She has a very severe adenomyosis. So as a doctor, you should feel something same as the patient and to find a very correct and a very good way to help patient. The second is sick, and she said she sick many hospital, many doctors, and finally find me. She feel me like angel, but I don't think so. The third step is calm. Actually, it's kind of in China, the Mandarin Wu means many things, very deep meaning is you should think something very deeply. The first is to live. You try to live well with a very high quality. So this is a beautiful lady. Also, she is the doctor also. So the trust of patients and peer is the driving force for us to move forward. This is a painting from my youngest son. Here we can see the crystal inside the uterus, protecting uterus may defend the dignity of woman and creating more harmony life. This is my HIFU team. I have several assistants. They are very well. And I also have very three big and great women in my heart. First is my mother, very gentle, kind, and very brave lady, and she has 5 children, including me. I am the youngest, my biggest brother living in Istanbul. And the second lady is our very famous pioneer, Professor Lin Qiaozhi, who created and established Peking Junior Hospital, and cultivate my PhD supervisor, Professor Lang Jinghe, also an amazing hand in our house, whole China. The third is Mother Teresa. I want to use her words. We can't all do great things, but we can all do small things with great love. And welcome to Shanghai in some time, no any virus. I hope everyone stays safe and healthy during this difficult time. See you in the future. Have a very nice day. Good night.
What I was going to say is when I did my initial training in China, I was in Chongqing and Swining for about 6 weeks. And then when I came back to South Africa, Chongqing provided me with excellent teachers who worked with me for 1 year until I was competent enough to be able to do it on my own. So I couldn't have done it without Chongqing support.
So you have somebody sitting next to you for almost a year.
Yeah.
Ooh.
I had 4 different doctors. Each one came for about 3 months at a time. We worked together, and after a year, when I was competent, they left me on my own.
Okay. All right. Okay. Hugo, you have anything else to ask, or ask anybody? Especially you want to ask. You were saying you're going to torture Dr. Olarik with your questions. Hugo, I can't hear you. Your mic.
Okay. Better?
Yes.
Yeah. So,
We can hear
well, that's what I expected from Raymond, of course, because my very limited experience tells me without initial help during the 30, 41st cases, you cannot, it's impossible to do it. And I know South African patients that are disasters, those patients. So I'm very happy to hear how Raymond did that.
We don't see a lot of adenomyosis in our black population. Of the
Really?
Yeah.
Is that
we see a
true?
lot of it in the white population, but we don't see much in the black population. So we've treated, I think, only probably about 20 patients with adenomyosis, and the results we got were very good.
So, Raymond, are you saying that adenomyosis in South Africa is much more, how should I say, relevant in the white population as in the black population?
Yeah, the same with endometriosis. We hardly see any endometriosis in our black population.
No, adenomyosis.
Yeah, no, but I'm saying both adenomyosis and endometriosis, mainly in the white population. We hardly see it at all in the black population, but then fibroids are extremely common in the black patient.
Oh, I didn't know that. So that's interesting.
So we don't have much experience with adenomyosis. We've only treated about 20 patients with adenomyosis.
Black patients.
Black patients.
May I share something?
Okay, sure.
Yeah, please. All right.
Yes. Okay, I think for the adenomyosis, it depends on the goal of the treatment. Okay, for the treatment for the pain or the abnormal bleeding, I think the HIFU is like a tool to like destroy the lesion. But after that, I agree with Dr. Aili to use some medical treatment to suppress and to protect the recurrence of the adenomyosis, because we know that if the patient has the estrogen, the disease can come back. So in my opinion, I don't have the experience on HIFU, but I think after treatment with the HIFU, we have to give some hormonal treatment lifelong until her menopause. This is my opinion for treatment of pain and abnormal bleeding. But for the patient who has the infertile, I think the treatment is big difference, because we try to get the pregnant is very early, as soon as possible. So I think the strategy is very different between two sides of the patient. This is my opinion.
Yeah. Any more questions or comments?
Yeah. We have two questions from chat room.
Sure.
First from Victoria Rowena CC. She asked about the cost of the HIFU procedure for adenomyosis in Chongqing Hospital or in Singapore. Maybe Dr. Keen can answer the question, the cost.
Okay, sure. The cost of the treatment of adenomyosis and the patients, I think most of us have done in Singapore, usually is covered by their personal hospitalization insurance. So ballpark figure, anything for a short procedure, a simple adenomyosis, to somebody who has to do it for 3 hours and all this, varies from, let me see, I have to think in terms of Singapore dollars and convert. Okay, it is something like US 15,000 to US 25,000 ballpark figure. Really depends, all in ballpark figure, including MRIs and blood tests and all. But you must understand, even an MRI in Singapore costs about US $900. And I understand in Chongqing, they can do MRIs before the procedure, immediately after the procedure, and then 3 months, 6 months, 9 months, and a year. But we can't afford to do MRI for follow-ups. That comes to the question of, especially I'm going to ask Raymond, do you use MRI for follow-up? Because after that, I normally just do one MRI for patients who can afford, and I just follow up with just pelvic ultrasound.
So we do one post-treatment MRI at about 6 months. We've only got one MRI machine for the entire hospital.
Okay. What about ultrasound? Ultrasound follow-ups? Do you do that?
Well, we do ultrasound follow-up. So we do ultrasound at 1 month, 3 months, 6 months, 12 months, and 24 months.
Sure. That leads me to what I have always been thinking. Why don't we use 3D ultrasounds, like what we use for babies, pregnancies and all this? Why are we using 2D ultrasound? So this is a question I'd like to pose to everybody. Has anybody thought of using a 3D ultrasound for follow-up? Okay, if not, then is there another question?
Yeah. From from Vishnu Sharyawan, I think it's from Indonesia.
Mm-hmm.
He asked about what happened with the ablated tissue. I saw they created a space hollow in the uterus. It can be resolved spontaneously over time. Maybe you can answer the question, Dr.
Okay, sure. I just saw my teacher Zhang Lian on the line, and I think Raymond can answer that too. So maybe Zhang Lian, you try to answer the question first, and then we come back to Raymond. Then I'll give my 2 cents worth. Zhang Lian, have anything to say?
Yeah, I'm here. Yes. So yeah, about the complications, HIFU treatment right now at this moment, I think is really safe. So the complication rate is very low. So the most common complication is about the skin burn. So when the patient had like the previous surgery and the abdominal scar, so then for this kind of patients may have a higher risk to get the skin burn. So during the treatment, so we have the protocol yeah, like for example, when we solicate for 50 seconds, then we have decreased a transducer and slow down and check the skin, then we do it again. So for this kind, so follow this kind of protocol, it's like the skin bond, the rate is like the 0.1%, something like that way. So law is very safe about this.
Okay, Raymond, you have anything to add to that?
Yeah, just adding on to what Leanne said. I mean, that's why it's done under conscious sedation. The patients will warn us if the skin is getting hot. So we will then take precautions, and that's how we prevent it. So if they tell us the skin's getting hot, we'll lower the transducer, we'll stop treatment, we let the cold water come into contact with the abdominal wall. Yeah, so and in terms of complications, injury to bowel or other structures, we make sure when we're treating that we leave a margin of about 1 centimeter from the edge of the fibroid to allow for dissipation of heat. And therefore, because it's such targeted treatment, it's a very safe procedure. We have very low complication rates.
Well, let's come back to my learning curve. So, and that's why I always emphasize.
May I ask something, Professor Lee?
Yes.
Raymond, you say your complication rate is very low. Are you sure that the patients with complications are coming to you? Because you have patients from all over South Africa. They come to you, you treat them, and they disappear again in their villages. So if you have them complications later, how high is your loss to follow up for your patients?
We have got a problem. I mean? Yeah, no, for sure. Yeah. Plus, we have patients coming from across the borders as well. Yeah. But we probably, patients that are coming from out of our Johannesburg area is probably about 10%. But what we do is when we discharge the patients, we give them a letter to their doctors, please to inform us that if there are complications, they'll let us know. But we do have a bad follow-up with some of our patients.
Yeah.
But we probably, maybe we do lose some to follow up.
Yeah.
But of the ones that we see, the vast majority, over 90%, come back for follow-up. And there we know the only real problems we've had are 2 cases of superficial skin burns.
Oh, okay. That's great. Yeah.
Okay, I think,
thank you.
Okay, thank you, Prof. Aili. There is some question from the chat room. How is the adverse effect on implantation after HIFU from your experience, implantation rate?
Actually, I'm busy typing the words to the message, and also Professor Zhang Lian answered this question. So mostly 2 side effects. One is bowel injury. We happened one at the first year. The second is skin injury. Am I right, Professor Zhang Lian? Two sides, yes, 2 aspects. One is bowel, skin, but it's happened very rare. If you had a very good procedure, keep the good reason like music or dancing, not to hurry, be careful. It will not happen forever, I hope.
How about for the implantation rate after the HIFU for the infertility?
Nearly at least 70%.
Okay.
Ooh.
Okay, there's another question here from the chat room from Dr. Melinda Rita. Question is HIFU appropriate for a 47-year-old with adenomyosis and a 6 cm funded adenomyoma? A patient doesn't want surgery.
That is a very popular situation. So many women, sometimes psychologically, the woman's heart is very hard to understand. So there is a very old saying in China, woman's heart like a undersea needle, Professor Lee, 女人心海底针. So mostly the woman wouldn't like accept surgery. So we have so many excellent surgeons. They can do the laparoscopically or types of surgeon very well. But mostly the women wouldn't like accept any surgeon. They wouldn't like had any incision on the abdomen. So we have some actors and some models. They wouldn't like had any injury. So HIFU is a very good choice. No any incision, no bleeding, non-invasive, very gentle. The patient can talk with you. You can the patients can see some video, listening some music. So you can destroy the lesion very quickly sometimes.
Okay, there's another question asked whether is HIFU suitable for diffuse adenomyosis.
Beg pardon?
Is HIFU suitable for the patient with diffuse adenomyosis?
Very suitable. Unfortunately, I prepare very good case on my slide, so I'm not very sure what's happened on my computer. So it's very good for diffuse. It's like electrical curve can ablate all the lesion.
But you must understand, Professor Aili, you know, when we do HIFU for adenomyosis or even for fibroids, we are supposed to leave a corridor of safety from the serosal layer of 1.5. So if it's diffuse, how are you going to treat the adenomyosis that has reached the border of the uterus?
Yeah, we can treat the areas, the safety area we can treat, and after HIFU, we can use medicine to control the menstruation. So sometimes for very hard case, the choice is the menstruation and the uterus. So if you want to keep the uterus, just stop menstruation. So we call adenomyosis and the endometriosis like pelvic vampire. No bleeding, no menstruation, the disease can be stopped. So after HIFU, we can use some gospel, like I mentioned in my slide, unfortunately. So this kind of medicine, gospel, 棉酚, is very magic medicine, can stop the woman's menstruation. So stop the menstruation, no pain. The uterus can be relieved. So what kind of big, huge lesion, it can be healed.
May I have ask some questions?
Okay, Olarik.
Do you think for the pre-treatment, I mean, give a GNIS agonist
Yes.
for HIFU? Is it easier to do HIFU because maybe the uterus is smaller? What do you think, in your opinion?
Yeah, that is very good question. At the beginning, especially for the very diffusion, big, huge adenomyosis, we use the GnRH 3 months, and then we do HIFU. But literally, we found it's not very good. So now we use after HIFU. The size of the adenomyosis, the more bigger is more safer for the patient, especially combined with DIE. Because very dangerous back posterior part of the uterus.
All right, can I just take a moment off, go back to the slides, since everybody is talking about pregnancies, and I show you, for those of you who wants to know what is the pregnancy rate like, this is taken from Chongqing. Already 1,500 HIFU babies, normal course of pregnancy, no incidence of uterine rupture. And I'm also very happy to announce in Singapore, well, my colleague, Dr. Hong and the rest of the team went to visit Chongqing HIFU Hospital and in 2018, and very glad to announce that Dr. Hong has successfully treated a lady with fibroids, and the lady is now a proud mother of a beautiful baby just 1 or 2 months ago, and that's Dr. Hong with the baby. So for anybody with any doubts about the effectiveness of HIFU and the complications of pregnancies, I really don't think so, because HIFU itself hasn't got a cut on the uterus. Let me continue. I'm very glad that Professor Wang Zibiao actually visited the HIFU Center in Farrer Park Hospital last year. I'm glad to host him and to show him what we have done for the hospital. And I have a heart-to-heart talk with him, and probably the first time I have the opportunity to talk to him about his experience with HIFU. You see, it is not the usual wine and dinner talk. I really grilled him, and it was the pouring from his heart of his trials and tribulations of his research, experiments, and commitment to HIFU. So if you walk around the compound of the HIFU hospital in Chongqing, you will notice there's a monument erected in honor or in remembrance of a HIFU pig dated 15th of August, 1997. So I would like you to hear a pre-recorded video, which he has specially prepared for us. When I asked him, please tell me the story of the HIFU pig. And with eyes full of excitement like a child, Professor Wang Zibiao told me this story. And you will understand it's a man with great commitment to medical science in search of an answer to alleviate the sickness of mankind. He sacrificed his youth buried in his laboratory with his team in pursuit of a belief that ultrasound energy is the next big thing in medicine. If he failed, he's a forgotten fool. But he succeeded, yet he kept his humble silence in one corner of China. He's a rare breed of great achievers to be admired, a one in a million. So I will show you the video here.
这个今天呢，我们在远程室看到哈这些图画，实际上全是数字化治疗，所以我们可以远程化。今天呢，这个很高兴哈，国际部这个有关这个由我们新加坡的李建威医生来主持的这个会议，我很开心。那么在这个会议这个中间呢，我来讲一讲这个海弗猪的故事。其实海弗猪啊，就是我们在研究这个聚焦超声呢，真正切肿瘤的一个刀尖呢，不是声学的刀尖，是生物学焦裕，是要在组织里面形成灵魂坏死点。这个坏死点随着刀头的移动，这个坏死点在移动，看到没有？这个概念哈，所以叫生物学焦裕。而这个工作到今天为止，我感恩大家，我们做了30来年哈，把这个问题解释清楚了。但是在解释这个问题上，以前呢，我们都是靠只要做一个焦点，觉得我们聚焦超声就可以切肿瘤。实际上我们走过了非常艰辛的路。早期在这个组织里面，不是我们这个聚焦超声就可以形成灵魂坏死点，是我们做可能有时候出现，有时候不出现。而且大量的不出现，那怎么来解决这个问题？我们实际上在经过了好几年的实验以后，突然有一天呢，这头猪啊，我们做的小型香猪，我们聚焦在肝脏里面的20个点，每个点都出现了灵魂坏死，一种理想的、完美的这个展示了刀尖的效果。每一个点都看到非常好的灵魂坏死点，边界很清晰，大小可控，简直这个我们觉得是上帝的安排。上帝，因为我们的千辛万苦感动了上帝，所以上帝给我们回报了，给我们体现了这个结果。那么这头猪啊，是我们历史的转折，所以我们把它叫做海弗猪。那天我们一般猪做了实验以后解剖了，我们会把它还到我们的动物这个实验中心去。那天这头猪我们就没有，我们大家跟这头猪啊，我们给它敬礼，给它默哀，因为它对人类医学，特别是聚焦超声治疗，是做出了巨大的贡献。而这个不是对我们团队的贡献，是对人类医学的贡献，所以我们给他竖了一块碑，然后我们上面就叫海弗猪，这个概念就是这样来的。 所以因为海福是海福这个团队，实际上真正的从专业上应该是对聚焦超声高强度聚焦超声这个消融手术做出卓越贡献的猪。
Then I went to ask him about how do you start on your first patients, because China was just opening up, and because of the strict laws and regulations, it was very difficult to conduct trials on patients. So it was as last resort that his first few patients with bone cancer approached his HIFU team for help. Now, we know it as HIFU. In China, they call it FUAS, Focused Ultrasound Ablation Surgery. These patients were resigned to face death, then to be amputated. Thus, under such sad circumstances, Professor Wang and team agreed to treat them with HIFU. Now you watch the video and observe the moving emotion of a great doctor, his inner feelings, and his gratitude to his patient.
第一例骨肿瘤，第二例骨肿瘤，甚至后面的骨肿瘤，我觉得这不是我们事先想到的。正好他们的家属、他们的父母亲说，患了骨肿瘤，最后到全中国这些医院跑下来说，只有截肢，而且截肢以后存活多久不知道，因为我们知道恶性骨肿瘤实际上我们一旦诊断80%甚至90%已经有远处转移，所以在这种背景下，这个父母不愿意孩子把这条肢体接了，能仅仅活几个月。他们希望的是，如果能够治疗能够保治，哪怕最后他走了，他是一个完整的人。这在中国的我们叫世俗的观念，是希望孩子是一个完整的，不管生命能不能保得住。所以在这种情况下，全世界在聚焦超声治疗恶性肿瘤里面没有先例，特别是临床治疗这个方面，骨肿瘤就是我们全世界的聚焦超声消融手术的第一例。那么在这种背景下，我们确实取得了成功，因为我们聚焦超声的生物学教育不仅仅是我们以前靠猪靠生物学实验、动物实验室切出来看，而在我们第一例、第二例的骨肿瘤里面，我们一聚焦，啪，这个点呢，焦点的地方在 B 超的灰度上，啪就亮出来了。后来我们总结发现，骨肿瘤是最好的聚焦超声治疗的这个疾病适应症。为什么？因为骨肿瘤里面，特别是我们是成骨肉瘤，那里面有这个骨的成分，可以把超声波的机械波转化成热能，所以很容易看到它的这个强回声的，就是灰阶的巨大的变化。那给了我们全世界这不是给我们信心，是给了全世界这个领域的信心。那么很感谢那些都是孩子，我们有的孩子我们延长了生存期，有的孩子今天哪怕20年以后的今天还活着，而活着的孩子他的肢体是完整的，所以我们怎么说呢？这个技术哪怕有时候看到一个孩子20年前可能我们是要高位截肢，甚至能不能保命我们不知道，而今天他不但保了命，而还是完好的一个人，他没有残疾，他的肢体是好的，还长在那儿，还保留在这儿的时候，我们开心。所以我感恩这些孩子对人类医学的贡献，也非常的感恩我们这个医疗团队让这项技术在这个第一个实验证里面取得了成功。所以第一例、第二例的贡献对这个领域可以说是里程碑式的贡献。
Okay, thank you very much, Professor Wang, and on behalf of the cancer patients, really a big thank you. Let's come back to question and answers. Okay, there's a question from I think Relly asked the question himself. Every adenomyosis patient always receive combination medical treatment, even for patients who wants to be pregnant? I think this is a question from Dr. Relly to Professor Aixingzi. Well, Dr. Samsu Hadif has a question. He
Yes.
raised his hand. Please.
I would like to ask how the recurrence rate, and if the adenomyosis with infertility, how long we can wait for becoming pregnant spontaneously or by IVF?
I think I can give the answer.
Okay.
Yeah. Generally, we always, if the patient won't have the plan to get a baby in the future, so when we treat this patient with, with adenomyosis, we have to protect endometrium. So the lung perfused volume ratio is around 50%. So after that, we just suggest them wait for 6 months to get conceived. So generally 6 months after HIFU treatment for pregnancy.
How about for the recurrence rate, Prof. Chan? Recurrence rate of adenomyosis after HIFU?
It depends the classification. For example, like based on the MRI, if this patient with, for example, type 1, like say intrinsic adenomyosis, if they don't want to if they already complete the childbearing, for this kind of patients, we can completely ablate the adenomyotic lesion. For this type, the recurrence rate is lower, but we don't have the number for the total patients. Generally, like our paper already for the 2 years, complete 2 years follow-up. So the symptom improvements, symptom relief at the end of 2 years, like around 80%. It means like the 20% may have the symptoms come back after 2 years. Is that your question, right?
Yeah.
Okay. So right now, I think also we're working on this for the different type, use different protocol to treat. So in the future, I think probably next year we are going to present the results for you guys.
Okay, I think Dr. Samsu Hadi still has a question to ask. Dr.
If there is a recurrence, can I do HIFU for the second time?
Yes, for sure. Yeah, because it's a non-invasive. So like I already showed, probably Dr. Lee already knew my first case. The case I treated in 10 years ago. So after the treatment, symptoms disappeared. So 2 years later, she had the symptoms come back again. Then we performed a second session of HIFU treatment, then get very good results with any complications. So because it is non-invasive, for adenomyosis, we can treat it for the second time or third time even.
Okay, can you add to that? Because they're wondering whether after HIFU treatment for adenomyosis, can they get pregnant soon? And secondly, can they have a normal delivery?
Yeah, Professor Zhang Lian answered very well. Actually, I already answered on the WeChat the platform. So it can pregnant easily. I mentioned I have a 45-year-old patient. After HIFU, she pregnant 2 times. When she come to me next year, she opened the door and said, "Oh, it's easily to get pregnant. Side effect for HIFU." So she mentioned easy pregnant is one of the side effects. So we have some of patients after 40 years, they have no any plan to have a child again, but after treatment, all of them pregnant. It's like a little bit not very good because I against abortion in China. So we will do good protection to stopped pregnant for some of patients. So not a problem for HIFU patient after 3 months or 6 months. Professor Zhang Lian already answered the question.
No.
Prof. Lee?
Hi, yes.
Prof.
Yes.
Lee, I have to go. I have to go to theatre, so I'm going to have to leave.
Raymond, thank you so much for joining us. Thank you so much.
Thank you for having me, and thank you for inviting me to speak.
Oh,
Thank
don't
you,
forget,
Raymond.
don't
Thank
forget
you. Bye, Raymond.
South Africa.
Thank you, Raymond.
See you in Soweto, Raymond. Come to
Absolutely.
see you.
All
Looking
right.
forward to seeing you.
Yeah. Goedenavond.
李教授，李清龙教授，你是不是要
Yes. Okay. Thank you for thank you for very good chairman, the moderator these sessions, and also thanks for the Professor Wang Zibiao to have present the so wonderful the HIFU peak and also the bone cancer in treatment by HIFU. And is so impressed. And I have one question for Professor Zhang Lian, because in the if we concerned about the same size of the adenomyosis and myoma uteri in the same size, for example, maybe 5 centimeters, the same size. But how about the treatment operation time? Is very compatible between the treating adenomyosis or myoma uteri, or they are quite different? Because as we know, when we treating the adenomyosis, the patient will feel hurt quite a lot. So maybe we will slow down our procedure and our voltages in the treating. So how about did you have any paper or any data showing about the operation time between the adenomyosis and the patient with the myoma when you treated them, and when which will be more quick and maybe more convenient for the doctor in treatment?
Yes. Dr. Lee, Professor Lee?
Yes.
Yeah. Yes, a very good question. Like I discussed with you before, for myoma, it's much easier for us to evaluate based on MRI to know which one is more easier, how long it's going to take to ablate the tumor. But for adenomyosis, it's much more complicated about this. But anyway, right now I think based on MRI, for example, like the intrinsic adenomyosis, also it's more easier. It's more easier, and also based on the MRI, we can say, like the hypo intensity on T2, and also if we don't say any like the on T2, we didn't say the like the sex or something like that. For this type is also easier. So I mean, MRI is also help us a lot. But I mean, probably next year, I think we can show our data about the adenomyosis different type, how long it's going to take for the HIFU treatment. The solution time, even like something like that.
Okay, thanks a lot. Yeah,
we can do that.
Yeah,
to show you guys.
Yeah, thank you. We learn a lot.
Right on.
Yes.
Okay.
I think we learn a lot from the Professor Zhang Lian. Thank you for your comment. Yeah.
Professor Zhang.
Yes.
Have you performed Doppler blood flow to the uterine, to the uterus before and after your treatment for adenomyosis?
If the patient they don't want, they don't have the plan to conceive, then we can do this. Yeah, put this in there. After HIFU treatment, we can get this device, put the device in there. Yeah.
No. This is not a device. This is the Doppler ultrasound for blood flow. The blood flow to the uterus.
I'm sorry.
Have you measured their blood flow? Is it better? Does it improve?
Yes, the Doppler ultrasound. Yes, before and during or after, we can use a Doppler ultrasound to check the blood flow. Yes, it works. It's helpful.
It works, yeah. It improves a lot.
Yes.
Yeah.
Mm-hmm.
Thank you.
Thank you.
I suppose the final verdict, especially for those ones who are pregnant, is whether they get pregnant or not, whether the Doppler blood flow has improved or not. Basically, what they want to the patient is pregnancy. Are there any questions? If not, then I show a few slides before I end the session. Okay, are there any more question answers before I conclude my the last episode? Okay. All right, I've done that. Okay. For those of you looking out for summary of episodes 2, 3, and 4, which I normally do that, but unfortunately because of the time and I'm still waiting for answers from some of the previous speakers. So maybe just watch this space in the next episode, if ever we have a next episode. But I think we will because of the interest generated, especially on adenomyosis. Just a question that somebody asked me long ago, will HIFU replace open and minimally invasive surgery? My answer is no, for many good reasons, because not every fibroid is the same. Not every mind of women are the same. Okay, in my opinion, the preservation of femininity and fertility, HIFU is an excellent alternative treatment for fibroids and adenomyosis. We know that right now in the world, it is often late marriage because of career, because of the education. But if women ask for ovarian or egg freezing, have you ever thought of women may ask for preservation of uterus for whatever reasons? That is food for thought. If I show you this picture of a scholar, then if I look to the right, you can see camels and horses, looks like a traveler. And if I show you the next picture, you will know that I'm talking about Marco Polo from the 1254 to 1324 AD. And what this traveler has done, Marco Polo, he started off in Italy, Italy, Venetia, and all the way Venice, and all the way to the east to Mongolia and China. He has the land road, the Silk Road, and he has also a maritime road. Now, what is the relevance of this map to us today? This is the beautiful part of the Silk Road. You can see sand dunes, camels, and animals accustomed to desert. You can see very hardworking people, Chinese people from the Muslim side of China, and beautiful buildings, palaces, and an oasis, and also mountains with different colors. This is the beauty of the Silk Road. Well, Marco Polo came to offer his knowledge and culture to the Orient with warmth and love. He was respectfully accepted and returned to Europe, bringing with him the riches of trade, peace, and Oriental culture. How does it relate to present day in the world? Well, we would like to welcome more Marco Polos to help us spread the good. And you know, when I was a child, I loved this fairy tale called Journey to the West, the folklore. And this is to me like what is Harry Potter to my grandchildren now, but I think I'm still 一个长不大的孩子。Now, from folklore to a modern day reality, and who says dreams do not come true? And when it comes true, it's God's gift of renewal of love, friendship, and brotherhood. Let's cherish it in good faith with peace and the exchange of knowledge and kindness. This is very similar. What we know today as one belt, one road, and one heart. A similar Silk Road and a similar maritime road. So let us continue the journey of progress for mankind. 就是说，在跑这条路会遇到很多妖魔鬼怪，但是我们不管了，只是用一条线去进步我们所需要的、所需求的为人类。And I think, as doctors and nurses and caregivers, share the knowledge, spread the goodwill, cast aside all the man-made hurdles. Together we bring peace, love, and health without borders to our world. And I hope together we can have the sound of HIFU to be the music of health for everybody. And my last slides, I would like to reiterate, HIFU is not arcade games, not a bowl of water with ultrasound. It is acquiring a smart virtual therapeutic system that comes with research, teaching, learning, and management. It is a whole new world of surgery that demands our undivided attention, that is focus, judgment, skill, discipline, and discipline. So before I say goodbye to all my friends and to all the chairpersons, panelists, speakers, and audience, really you have given me faith. 真的很想念 my jump cake. I also need to say thank you to the wonderful team to help me. Most of them are based in Chongqing, and there's Tony based with me in Singapore. There's JPU who helps out every now and then, even middle of the night, to arrange the slides. And this is the Ping, the big man in charge of Europe, and his sidekick, good assistant Nathan Neal. And of course, Professor Rosie Singh, who is still orbiting around the world. I don't know which satellite she is in now. And the very, very important superwoman, Jenny, who helps out with everything. And she's really my walking encyclopedia. And a big thank you to the team. And a big thank you to Jenny and for me disturbing you throughout the day and night, even on Sundays. And a special thank you to Dr. Wang Qian, my great teacher, who's very, very patient with me as senior citizens and very forgetful, but she'll repeat again and again and teach me to all the protocols and all the guidelines, never failing and never angry with me. If I have another son, I will 我就要娶她做我的媳妇，但是 I don't have any more sons to get a daughter-in-law, otherwise she will my target. And of course, to my wonderful staff nurse, Sister Iris, to arrange for all the preparation for the HIFU patients and taking all my nonsense. Very big thank you. I never have a chance to say thank you to her. So this is a time to say thank you to her. And my wonderful company, all these are my bosses. We have obstetricians and gynecologists, we have pediatricians, we have cancer-related specialists, and we have dermatologists. And this is handled by Mr. Eric Chu, my CEO, and Dr. Bei Suantiong Ma Yishen is the executive chairman. And I think it's time for me to drink my coffee. It's cold now, and I think dinner is also waiting. Thank you so much. And this is something which, in my travels to China, I noticed this. And I'm Dr. Lee from Singapore ONG. A big thank you to all of you for having me. And bye for now. Thank you so much, all the speakers. Thank you so much, Zhang Lian, my 老师, and thank you everybody. 真的很想念, 很想念. That's my last slide. And I think it's time for us all to go, either go home or go and have our dinner. Thank you very much.